Dr. David Snead. David has been a full-time NHS consultant pathologist at University Hospitals Coventry and Warwickshire since 1997. He has led the project to adopt digital pathology there for the last decade and now heads the UHCW NHS Trust Digital Pathology Centre of Excellence, an academic venture exploring the use of the technology in routine histopathology. He collaborates closely with academic colleagues at the Computer Science School, University of Warwick, and is currently evaluating algorithms aimed at improving the pathologist's lot through the automation of mundane, time-consuming quantitative tasks. So that certainly sounds appealing. He will address that today within his talk entitled PathLAKE and the Emerging Role of Artificial Intelligence in Digital Pathology. David.
Great, excellent, thank you. So thanks again for the introduction. And as Maurice said, I'm now leading the PathLAKE, one of the centres of excellence established in the UK to exploit artificial intelligence in digital pathology. And prior to that, I was the clinical lead for cellular pathology in Coventry, and it was my duty to deal with the finance department on a regular basis. And our relationship wasn't great, but we did get some useful information out of them eventually, and this is one of them. It's an estimate of the workflow, well, it's a record of our workload in Coventry over the previous 10 years. On this side of the screen is the number of samples we received over that time per month, gradually increased over that time. And on this side of the screen is the volume of slides that we generated from those samples. So in the 10-year period, for a roughly 2 to 3% increase in workload, we doubled the slide volume we created. And that just is an indication really of the changes that have taken place in cellular pathology in particular, which have made brought a great deal of pressure, I think, into the services that we're running. So PathLAKE was established to get digital pathology into practice and start to use it as a means of developing artificial intelligence algorithms and make the data available for ourselves to use and for other companies to develop algorithms of benefit to us. And we're halfway through the program, just over halfway through the program. And that's a summary slide here, some of the achievements that we've managed to date. Part of the time has been spent actually applying for yet more money to run PathLAKE Plus, which is an expansion of the digital footprint from our original 4 trusts across to nearly 21 NHS trusts covering a population of around 17 million. And I'm glad to say that this was supported. So we're going to be starting off PathLAKE Plus in January next year, and this will bring together the East Midlands with ourselves in Coventry, Oxfordshire, Peninsula Group, Bristol and Southampton and Addenbrooke's. And the various populations that those hospitals served are shown in this diagram here. Really to bring digital pathology across to those labs, so the workflow is available in digital form. And the reason to do this is to allow a bigger return really on the investment in artificial intelligence to get it into practice in a wider area. We will also be linking up towards the end of this program with other digitalization programs which are ongoing in the West Midlands and in the Leeds group. So they will get the benefit of some of the AI that we're putting into practice as part of this program as well. So this will deliver an enormous amount of data in digital whole slide image data, and predominantly for exploitation. And we intend to make this available in the PathLAKE data lake. So not all of the whole slide images are going to end up in here, but a considerable proportion of them will do. And it's not just that data, it's also other data from the electronic patient record and other digital warehouses that we can access data from, a sort of metadata to go with those whole slide images, which is going to generate the value of the data lake. We have a analytics engine located with the data lake to allow analysis of that data, so you can teams and companies can load their code onto this analytics engine and test it out on the data within our data lake. And that's really one of the main ambitions for PathLAKE, that we allow this to happen, that we allow NHS partners to put their data into the data lake and allow that to be used for research and development, both for primary research, but also, of course, so we can run services, for example, for testing out algorithms and providing information accuracy and effectiveness back to those that have developed them. We think there are really, well, there's three broad areas where AI algorithms are going to be of benefit. We've already heard from Thomas this emerging area of regions of interest detection, where AI algorithms can do a lot of the hard work of pre-screening sites for pathologists to find areas of interest. So this is a slide from the Chameleon challenge showing metastatic breast carcinoma in a lymph node, and we're all familiar with the time we spend scrutinizing lymph nodes for evidence of metastasis. The fact of the matter is that this can be done by these algorithms, and these areas can be pre-selected for the pathologist to view, greatly reducing the amount of time that's needed to screen all of those slides on these cases. And we're all familiar, I think, now in cellular pathology with image analysis, and it's the way that that's been used in immunocytochemistry. It's really got into practice, but this is changing now. This is an image of Ki67 staining. And instead of having to count these cells, the algorithm will do that for you and give the proportion of percentage of positive cells in that field. So you no longer have to get your cell counter out. You can just run the algorithm and get the results from that. And this over here is an image. This is one of our algorithms. This is a false color image overlay on invasive colorectal carcinoma. It's a chronic carcinoma in this case. And this algorithm is predicting risk for MET-free survival in resected colon cancer. And this was actually quite a powerful predictor of metastasis-free survival, stratifying patients into high and low risk for future recurrence of the disease. And clearly this is a major interest in oncology, because these patients are a large group of patients end up in this group of resected tumour and uncertain as to whether they're going to get further trouble or not. So this is a major help really in stratifying those patients into these risk groups. So all of these things I think will emerge into practice in the next few years. Whether we'll actually get to this stage of AI actually reporting the slides for us, I think is another matter. Whether we can rely on the analysis of the pixels from the images by the AI to classify samples into various groups, normal or abnormal, for example, or not, I think is open for debate. Certainly in PathLAKE, our view is that this is possible, and one of our goals is to achieve this, is to develop algorithms which will recognize some samples as normal, and these guys here will no longer have to look at those in the workstream. They'll get an automated report issued, so that their time can be spent more usefully on more challenging cases. I think we need to give careful consideration really to how AI is going to be used in practice and how it's going to be looked after. This paper we published in Journal of Pathology last year was intended to at least give a roadmap of how AI tools can be developed, what the various steps in the pathway are, and it's needless to say, quite complicated, and there's a lot of work that needs to be done to get anything through into practice. And all of these hurdles really needed to be overcome. But once this has happened, of course, and there are some products now which are through regulation and available for use. Visiopharms have products in for several years. Page, who we just heard from Thomas, has successfully got their prostate tool through FDA clearance and so on, and IBAX is following as well. So these products are becoming available, And we then need to work out how they're going to fit really into our laboratory, how we're going to adopt them, what sort of in-house adoption testing we're going to do on these products, how it's going to be documented, how we present that to UCAS, and of course in diagnostic use, how we record what we've done, how these images are stored, how they're linked back to that record, how we know which version of the algorithm has been used, etc., etc. All of this needs to be dealt with, and it's all new stuff, really. I think to all of us, and going to be quite a challenge, I think, to get this into practice. But I think that the rewards are there to be made. We expect to get a 12% gain from digitalizing the workflow, just in terms of having it work but electronically and being able to move it around more effectively. But that goes up to 30 or 40% gain in productivity of pathologists once you get the AI solutions into use, depending on what their purpose is. So this is a big return, really, on the effort that's involved in implementing artificial intelligence for pathology. But and so it makes it worthwhile. So these problems, I think, they may seem insurmountable or complex and challenging, but they are worth tackling because the rewards are extremely great. And obviously there's a large list of people that have been involved with the PathLAKE project. Some of them are listed here, and I'm grateful for them and all of the support that they have shown over the past 18 months or so. Thank you very much.